My project was on exercise during pregnancy and its effects on oxygen intake.
Okay, so a few things that I'm going to talk about today. I'm going to have a few bullet points on the oxygen levels during pregnancy here. And then I also found a study that they took 12 pregnant women and put them on a Monarch bike in different stages of their pregnancy. So I'm also going to be talking about that today. So the maternal rate of oxygen consumption rises progressively during pregnancy, reaching about a 20% above non-pregnant levels. As you can see on this graph, it does show here, this is when you're not pregnant, the difference between here is rest and here is exercising. And then it does go up right here, about 20% just as rest, and you can see that increase as well in exercising. So because of this increase in resting oxygen requirement and the increased work of breathing caused by the pressure of the enlarged uterus on the diaphragm, there is also a decreased oxygen availability for the performance of aerobic exercise during pregnancy. This causes a decrease in maximum exercise performance and workload. Okay, so on to our study. For this study, there were 12 pregnant ladies. They were basically selected based on their health screenings, and their age range was between 25 to 34 years old, averaging in the weight of 60.6 kilograms. So they were all very healthy and very physically fit. So each woman was tested monthly during their pregnancy, and then again at 2, 6, and 12 weeks postpartum. These studies were all done in the morning after a breakfast of orange juice and toast. So they did this study on the Goddard bicycle ergometer with a nose clip and a mouthpiece to capture all the air being expired, just like the bike that we did in one of our labs, looking just like this. And then also, just like our lab, they were conducted at a workload of 50 watts and pedaling at a rate between 40 and 50 RPMs. So the main reason that they tested on the bike instead of like a treadmill or anything else like that, it's because it theoretically could take away from the changing in weight burden that these women are experiencing. So each collection of expired air during rest, exercise, and in recovery was all analyzed for oxygen partial pressure, and the concentration of oxygen then the expired air was also calculated. The results of the study were that the resting VO2 increases as pregnancy advances. During the standard steady state exercise, VO2 progressively increases as pregnancy advances. The increase is statistically significant from 27 till 30 weeks until delivery. Exercise VO2 increased by an average of 15% at 39 to 42 weeks of pregnancy when compared to 12 to 14 weeks postpartum. The average VO2 during recovery is increased in pregnancy as well. There were significantly greater oxygen debt at 35 to 38 weeks of gestation than 12 to 14 weeks postpartum. These results do support their hypothesis that the oxygen consumption in pregnant women increases during rest and during exercise.